it's Sally here. As a physiotherapist and Pilates instructor, I know how confusing it can be when we give cues like neutral spine or lengthen your spine and your client stays as you like. It's a real issue. If our client doesn't know where their bones are positioned, they certainly won't know how to move them effectively. That's why today we're going to explore essential bony landmarks that will instantly improve your cueing, alignment checks, and client understanding. So grab a mirror or your own body or your friend and let's learn together. So what are the bony landmarks? Bony landmarks are palpable points on the skeleton where muscles attach, joints move, or we measure alignment. They give us a reference like GPS points on our body so we can see and feel what's happening during that movement. In Pilates, we use bony landmarks to cue the alignment, check the alignment, guide cueing, and observe imbalances and compensations. So let's go top to bottom. We'll break into 3 parts. First, spine and trunk. Second, pelvis and lower body. And third, upper body and arms. Firstly, we're going to look at the skull and spine. Occipital bone. It is located at the back and base of your skull. It is important for head alignment and neck movement. I want you to try gently noting. Can you guys feel the sub movement that comes from the occipital bone? Second one is spinous process. You can feel this one down the center of your back. It is useful for tracking spinal movements such as spinal flexion, extension, and rotation. And next one is sternum, known as breastbone. It's a central reference for ribcage alignment. So it is great for cues like lift through your sternum in chest expansion or spine stretch. Last one is inferior angle of the scapula. This is the lower point of your shoulder blade. We normally use this to assess scapular movement or winging during exercise like arm circles or any shoulder exercises. Now we move on to the second part, pelvis and lower body. First point is anterior superior iliac spine, which is known as ASIS. Those 2 bony points are located at the front of your pelvis. It is crucial for tracking pelvic tilt and neutral pelvis. We normally say to client, try placing your hands on ASIS during footwork or bridging. Second point is ischiotubrosities, which is sitting bones. This is the points that we normally sit on, and this is a key reference in seated stretches. Next one is greater trochanter. This is the prominent part of your outer thigh. And then this is a guide for hip alignment during sideline or any leg circles. Next one is patella. This bony landmark is useful for knee tracking in dynamic exercises like squats, lunges, and leg work. Last one is medial or lateral malleolus of the ankles. This is the inner and outer ankle bones, and it helps with observing foot alignment and balances when they're doing the exercises, especially single leg exercises. Lastly, we're going to go through the bony landmarks in our upper body and arms. First point is clavicle, collarbone. It is easy to palpate and observe. The common cue that we use is burden your collarbones. Second point is acromion process. That is a tip of the shoulder. It is useful for monitoring shoulder movements, especially shoulder extension, shoulder elevation, or tension. And olecranon is the bony prominence of the elbow, and this is great for tracking arm rotations and elbow tracking. Knowing bony landmarks are essential because first, precision in cueing. When we say align your hips or keep your shoulders down, we are referring to these landmarks. This makes our instructions clear and help us to adjust our client's body correctly. And another reason is to improve alignment. By knowing landmarks such as ASIS, the front part of your hips, or the scapula, which is the shoulder blade, you can better understand what it means to have good posture. Another reason is to enhance the safety. Correct alignment reduces the risk of injuries. Bony landmarks help us to observe and guide the client's body when they are doing the movement incorrectly. Now, let's talk about how we normally use these bony landmarks in our Pilates session. Whenever the client is laying in supine, we need to check their pelvic height. So we normally use the cue like, imagine there is a glass of water on your hip. Let's not spill it by tilting too much to front or backwards. These visual cues helps the clients imagine maintaining the balance across their pelvis without tilting, keeping the hips even. And I want you to think about other examples by looking at each bony landmark. And this is the everything that I wanted to share with you guys today. In the next video, we're going to talk about the joint, the place where the movement actually occurs, and we're going to also talk about why we need to know the joint for Pilates instructors. Then I will see you guys in the next video. Bye!